What we've hoped to create here at the Medical Safe Haven is a guide that clinicians can use to assess the future medical and behavioral health needs for people that are applying for the Backpage Remission Program. And again, that's a program that was created to create remission funding for people exploited on the website Backpage and cityxguide between the years 2004 and 2020. So this guide is really created in a way, hopefully, that clinicians can use it just to solely do that piece, give them a professional opinion on what are some of the monetary compensation needs of that patient to be able to receive potential behavioral health and physical health care moving forward in their lives. Now, we're basing this on our own experiences at the Medical Safe Haven, having provided over 8,000 patient visits. And we basically have built common both pathophysiologies that people face, both from mental and physical health, and then also kind of treatment paradigms. And we also did cost analysis for all of this so that we can extrapolate across the country what would this cost over certain timeframes that we've seen as common within this patient population. Now, right off the bat, I apologize about this being kind of a cookie cutter, one size fits all approach, but we were trying to create a system so that we could do this for a lot of people within a very short time frame and also decrease bias, increase equity throughout that process. But personally, I tell patients that each and every time when I'm seeing them that I apologize, this may feel cookie cutter. I also want to make sure that we tell them that we should not anticipate that the numbers that we come up with today will look anything like what they may or may not get through this remission process. It at least is a guide for them to be able to attach, or an expert opinion for them to attach to the rest of their application, hopefully working with an agency, lawyers, to fill out the rest of the paperwork. So with all of that being said, I'm going to go ahead and get started. We're doing a mock interview. Dr. Anderson here is pretending to be a patient of mine during one of these assessments. And so we're going to walk through this pretty much exactly how we're walking through these patient encounters. You're going to be Jane Smith today. Okay. And I'm going to start off by just saying, okay, welcome for being here. Thank you for being here. Hopefully today what we're going to be able to do is provide you an assessment of your future medical and behavioral health care needs or costs associated with those needs to help fully recover from the period of exploitation you may have experienced on Backpage. That being said, I just want to make sure that you have a little background on the program. I know you're here today, so you probably do have some, but I'm just going to run through very briefly with you. The Backpage Remission Program was created as a way by the Department of Justice to reallocate seized assets when these websites, Backpage.com and then cityxguide, were shut down, and reallocate that funding back to people that were exploited. And so if we go to the Department of Justice's website, what we can see is that they have their main website, and we can read about it, learn all about it, and we can scroll down to this frequently asked questions piece here. Now, if we go to the frequently asked questions and we go over to losses and we specifically look on or click on what kind of losses can I recover, we can see that it falls into basically three main categories: medical, behavioral health, and lost wages. Now, I would encourage you to contact the National Center for Missing and Exploited Children, who has pro bono lawyers that can work with you, help you fill out the form, probably make an assessment on the lost wages piece. They may also help you collect old records for medical or behavioral health, care that you've received. But the point of today's assessment is really just to look at this last bullet point on the medical and behavioral health, where we're looking at the future medical needs and the future behavioral health needs that a person may incur given this history of exploitation. And both of these must include, as it says here, a treatment plan by a licensed professional. So that's really what we're trying to do today. It was very helpful that you already filled out a couple of these pieces of paper for me, and I just want to review it again with you. So this is not going to be a medical appointment. We're not making any adjustments to any of the medications. We're not able to provide any therapy today. This is really just a monetary assessment, a dollar assessment of what these needs could be projecting forward. This will probably take about 20 to 30 minutes. And at the end of this, I'm also having you fill out or sign this release of information paperwork so that I can email you a copy of this. And I can also email it to the law firm you may or may not be working with. There's also some additional resources on here, and this has most of the information that's going to make this a very quick process for me working with you today. Does that sound okay?
Okay.
And so it's just basically name, date of birth, the years of exploitation when they occurred, and your email address so I can mail you that paperwork. Wonderful. So looking at those websites, you can also look at, this was Backpage Remission.com, the National Center for Missing and Exploited Children. Their website, should you want to access one of their pro bono lawyers, is backpageremissionnetwork.org. And so, again, I think there's lots of good agencies working on this, but they're a big one and they have a lot of expertise in this area. So with all that being said, everything sounding okay so far?
Mm-hmm.
Okay. So we're going to go ahead and start into the assessment now here today. And there's only a few pieces of information that I'm going to be putting in here. This letter you can see right now on the screen. This is the cover letter, and this is going to give the total dollar amount assessment that we'll be sending off. You already have your name and date of birth in here. I'm putting in today's date. So there's not much more information I need to add, but just so you know what this says, it says that I, Ron Chambers, I'm a licensed physician. I'm working in California at the Medical Safe Havens. I'm providing expert opinion today for you, Jane Smith, who's applying for compensation through the U.S. Department of Justice Backpage Remission Program. Now, it's important, speaking with the attorneys of the Department of Justice, that what we're putting into this, kind of the future behavioral health needs, the future medical needs, are solely related to those years of exploitation. And so I have wording in the letter to that effect. The conditions listed in treatment plans are solely connected to their experiences from being trafficked and are independent of other life events or medical or behavioral health conditions. And I am competent and qualified to make this declaration. Okay, so that's kind of basically what the cover letter says, along with, the dollar amount that we're going to come up with. Over the last 10 plus years, we've had over 8,000 patient encounters with lots of individuals, and we've seen those people for years now, many years. And extrapolating our experiences treating people that have had these experiences of exploitation, we've kind of run into common conditions that people have. Now, you may have things that aren't on this list, and we can absolutely add those. But I'm going to run through the list of things that we have here. We'll go through it together.
Yeah.
And we can then, come up with a plan. Okay. So if we look at the statement of expert opinion here, this is just basically, again, citing why we feel like we can give this expert opinion based on our experiences caring for patients. And here, looking at the trafficking history, this summary, basically all I need to know is the years that you were exploited on Backpage. Do you remember what those were?
It was 2006 to 2016. Thank
you for having that information. I'm going to go ahead and put those numbers in here. So I'll put that in. And basically, this is stating that, there was a period of your life when there was exploitation occurring on this website, and it led to chronic and severe trauma affecting both physical and mental health. And here's going to be the subsequent sequelae. Myself, personally, I've worked with, probably 1,000 people that have experienced trafficking, and I can tell you I don't think I've ever met somebody that hasn't had some PTSD from those experiences. And so when we go through this, there's going to be things that I think are going to be pretty common in people that have these experiences. But again, you let me know what resonates with you. So right off the bat, when we look at the physical and mental health conditions, chronic post-traumatic stress disorder, does that sound like something you've experienced? Okay. And PTSD, yes. Obviously acute. Anxiety and depression going along with that.
Yeah.
Has suicidality been part of your past?
Yes, in the past.
Okay. And then substance use?
Not right now, but before, yes.
Before, okay. But you're in a good place with it right now?
Yes.
Long-term recovery?
Yes.
Okay, great. No diagnoses of borderline or bipolar disorder, nothing you're currently taking medications for. Okay. Any issues with like urinary incontinence?
Yes.
Okay. And then bowel or degenerative changes in your spine or your back from injuries that occurred while you were trafficked?
Yes.
Okay. And any tattoos or branding tattoos that need to be removed
Yes.
potentially? Okay. And scar revision?
Yes.
Okay. And do any of these other things look familiar to you? You know, we're talking about dental disease from neglect, pelvic inflammatory disease, gonorrhea, chlamydia, syphilis.
Had that in the past.
Have you had any problems with conceiving or having children? Any fertility problems since?
Yes.
Okay.
Seeing a doctor for that now.
Okay. And pelvic pain or pain with intercourse? Okay. Anything else that you are dealing with at this point in time? Or
I think you covered it all.
most of it?
Yeah.
Okay. So when we go down past this point, what I'm really looking at is what are the common treatments that we could use, you know, and kind of the mindset here is my working assumption is that even if somebody has a job today, has insurance today, and is able to get these covered, you know, they may lose their job tomorrow. And what I want to have is, what if I want to have in a better world, you know, the resources that you could have moving forward in your life, to be able to receive the behavioral health care, the physical health care that's going to, you know, help with your long-term recovery. With PTSD alone, our experience is that most people really benefit from cognitive therapy, cognitive behavioral therapy, EMDR, skills training and effective interpersonal relations, or regulation or STAIR, group therapies, body and mindfulness-based modalities. And then, of course, there's going to be some medical treatment. So I'm going to click all these boxes. And then, of course, there's going to be medical appointments and tattoo removal. So those things look like that covers most of the information that we talked about so far.
Yes, you did.
Okay. Anything else on there?
No,
Treatment-wise?
not that I can think of.
Okay. So moving down, current medications. Are you on any medications?
Yes, I am.
Okay. We'll get to those in a few minutes. Okay. So we're going to scroll down here, and basically what we have, and this is really just to kind of discuss, you know, when we approach the behavioral health needs that people have that have, again, experienced this, there's needs that happen in the first days to weeks, and weeks to months, months to years, and then there's kind of a relapse prevention and just kind of a maintenance. And, you know, because all of us have bumps in the road, and there's times when we're going to benefit from having additional resources. And so looking at this, and then what we created is basically kind of a money value, a monetary number that is averaged across the country of what each of these treatment modalities might cost. And then we actually put that into timeframes, common timeframes that we currently see as far as how long somebody benefits from a treatment before, you know, they're no longer needing it or have gotten all the benefit out of it.
Okay.
And again, this is the part where I'm sorry, again, it might feel like obviously one size doesn't fit all and everybody's story is unique, but it is a way to try and just make this an efficient process to get as many people these letters as possible. And also, I think, again, to decrease that bias, decrease that, or increase the equity, hopefully we can do in the process. So when we click these boxes here, now you can see the money associated with them, and this is basically treatments, how many times a year, and then how many years we would end up doing it. And so we'll go through, click the boxes. There's CT, cognitive behavioral therapy, EMDR, STAIR, group therapies, family couples therapy, support groups, the mindfulness yoga, and then the medical psych appointments, okay? Now, if we click down to the next one, this is going to be some of the medical needs. And so we've touched on those. For the urinary incontinence, some people use medications. A lot of people might need like underwear liners or pads. Are you using those currently at this point?
Yes, right now.
Okay. So we'll go ahead and click this box. And again, this is going to hopefully give you the supplies you need ongoing for that. But no medications, no planned surgeries right now. And then the tattoos, we talked about these ones, we're clicking these boxes. And so now we're coming up with, and then potential infertility treatment, okay? And then also the PT associated with pelvic pain, pelvic floor training, dyspareunia, which is pain with intercourse, okay? So we'll check that box too. Now, medication-wise, which medications are you currently on?
Prazosin, Lexapro.
So I'll click those boxes. Okay, so we're going to go ahead and take the totals here, and I'm going to add up the amounts that we came up from that be first behavioral health section, the medical section, and then the medications. We're going to come up with a total cost, and we'll put that back up in the top of our letter. Okay? So at this point, I would take out my calculator and I'd literally add them up. I believe this one's coming around $190,000 would be what it would, somewhere in that ballpark. At the end of that, I would say, was there anything else you wanted to add to this?
Not at the moment.
Not at the moment? Okay. Do you have any questions or concerns or anything about this process?
When am I going to hear back?
So I'm going to get all this finalized. I'll be sending it back to you via email.
Okay.
And so if there's anything that you need changed, or definitely we can also send it off to the law firm. But if they decide that this part needs to be adjusted, let us know.
Okay.
And we can make adjustments as necessary. But hopefully this will be helpful. And I don't know if this means that it'll be $20, $200, $2,000, $120,000. I don't know what this means.
Okay.
But I hope this is at least helpful as you go through this part of the process to have this letter to work with.
Thank you for your help.